Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, exploring a novel approach to managing diabetes in our canine companions. The research investigates the effects of a medication called Canagliflozin, a sodium glucose cotransporter 2 inhibitor, in dogs already receiving insulin for their diabetes. Diabetes mellitus, a common endocrine disorder in dogs, often requires lifelong insulin therapy to regulate blood sugar levels. While insulin is crucial for managing this condition, achieving optimal glycemic control can be challenging. There's always a quest to refine treatment strategies and improve the quality of life for diabetic dogs. Sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors, have gained recognition in human medicine for their ability to lower blood glucose by increasing its excretion in the urine. These medications work in the kidneys, specifically in the proximal renal tubules, where they block the reabsorption of glucose back into the bloodstream. By inhibiting this reabsorption process, more glucose is eliminated through the urine, leading to a reduction in overall blood glucose concentrations. The beneficial effects of SGLT2 inhibitors have been observed not only in humans with type 2 diabetes but also in diabetic cats, and as an additional treatment in humans with type 1 diabetes who also require insulin. However, the use of these inhibitors in insulin-treated diabetic dogs had not been well documented prior to this study. While SGLT2 inhibitors hold promise, they are not without potential risks. One significant concern in both cats and humans is the development of diabetic ketoacidosis, or DKA, a serious and potentially life-threatening condition. Interestingly, this risk might be heightened if insulin administration is reduced or stopped while using these medications. The mechanisms behind this increased DKA risk could involve reduced kidney excretion of ketones, an increase in glucagon secretion due to lower blood glucose, and the inhibition of sodium glucose cotransporter 2 in specific pancreatic cells, and the breakdown of fats for energy linked to weight and calorie loss. While some concerns about acute kidney injury in humans have been debated and largely refuted by major studies, other risks associated with SGLT2 inhibitors include dehydration, urinary tract infections, and fungal genital infections. Given the increasing interest in the potential role of SGLT2 inhibitors in managing canine diabetes, this research team at the University of Pennsylvania aimed to investigate the effects of Canagliflozin in insulin-treated diabetic dogs. Their primary objectives were to determine if Canagliflozin could lower interstitial glucose concentrations, which reflect overall glucose levels in the body's tissues, and if it could increase the amount of glucose excreted in the urine in these dogs. They also sought to monitor for any adverse effects of Canagliflozin treatment, such as the formation of beta-hydroxybutyrate, a marker of ketone production, the frequency and severity of low blood sugar, both with and without clinical signs, and any signs suggestive of urinary tract infections. This study involved 5 client-owned dogs that had been previously diagnosed with spontaneous or naturally occurring diabetes mellitus and were already being treated with insulin. To be included in the study, these dogs had to have interstitial glucose levels below a certain threshold for a significant portion of the day in the days leading up to the study, ensuring that dogs with very high, uncontrolled diabetes were not included initially, potentially reducing the risk of DKA. Dogs whose insulin dose, type of insulin, or diet had been changed recently were excluded, as were dogs receiving steroid medications or showing signs of urinary tract infections, vomiting, or diarrhea. Dogs weighing less than 7 kilograms were also excluded due to the limitations of tablet size and dosing. Throughout the 10-day study period, each dog served as its own control, meaning their glucose levels and other parameters were compared before and after the addition of Canagliflozin, while their insulin dose and diet remained constant. On the first day of the study, detailed medical histories were taken, physical examinations were performed, and a flash glucose monitoring system was placed on each dog's back to continuously track their interstitial glucose levels. Blood and urine samples were collected to measure various parameters, including glucose, creatinine, electrolytes, and beta-hydroxybutyrate. Canagliflozin was dispensed on this day, but its administration was delayed until after a review of the initial glucose monitoring data to ensure the dogs met the study criteria. The dosage of Canagliflozin was based on the dog's weight, using information from previous studies on the safety of the drug in healthy dogs. After confirming that the dogs met the glucose level criteria and that their treatment regimen remained stable, owners began administering Canagliflozin once daily in the morning for 7 days, from day 4 to day 10 of the study. On day 10, the dogs returned for a final assessment, including a physical examination, removal of the glucose monitor, and repeat blood and urine tests. Owners were also asked detailed questions throughout the study about any signs of low blood sugar, urinary issues, vomiting, diarrhea, or changes in their dog's drinking, urination, and appetite. The amount of glucose excreted in the urine relative to the amount of creatinine, a marker of kidney function, was calculated to determine the fractional excretion of glucose. Now let's move on to the results of this important study. The researchers collected a substantial amount of data from the continuous glucose monitoring systems, over 2,800 measurements while the dogs were receiving both insulin and canagliflozin, and over 1,400 measurements when they were only on insulin. The median interstitial glucose concentration was significantly lower when the dogs were treated with both insulin and canagliflozin at 87 mg per deciliter, compared to a median of 212 mg per deciliter when they were only receiving insulin. This marked reduction in interstitial glucose levels strongly suggests that canagliflozin has a significant effect on glucose control in insulin-treated diabetic dogs. Furthermore, the study found a significant increase in the amount of glucose excreted in the urine when canagliflozin was added to the insulin regimen. The median fractional excretion of glucose rose from 0.3% when the dogs were on insulin alone to 1.1% when they also received canagliflozin. This increase in urinary glucose excretion likely explains the observed decrease in interstitial glucose concentrations. However, the addition of canagliflozin to insulin treatment also had an impact on the frequency of low blood sugar levels, or hypoglycemia. Hypoglycemia, defined in this study as an interstitial glucose level below 60 mg per deciliter, was more frequent in dogs treated with both insulin and canagliflozin. In this group, 19% of the glucose readings fell into the hypoglycemic range compared to only 4% of readings in the group treated with insulin alone. Moreover, the median glucose level during hypoglycemic episodes was also lower in the dogs receiving both medications. Despite the increased frequency and severity of low blood sugar readings, none of the dogs in the study exhibited clinical signs of hypoglycemia such as disorientation, weakness, or collapse. Importantly, there were no significant changes in the concentration of beta-hydroxybutyrate, the marker for ketones, and none of the dogs developed diabetic ketoacidosis during the short study period. Additionally, no other adverse effects such as vomiting, diarrhea, or signs of urinary tract infection were observed. Now, let's discuss the implications of these findings. The researchers concluded that canagliflozin may indeed have a role in improving glycemic control in insulin-treated diabetic dogs. The significant decrease in interstitial glucose levels and the corresponding increase in urinary glucose excretion provide evidence for the drug's effectiveness in this context. However, the study also highlighted a crucial consideration: the increased frequency and severity of hypoglycemia when canagliflozin is added to an existing insulin regimen. This finding underscores the importance of decreasing the insulin dose when initiating treatment with canagliflozin in diabetic dogs. In this particular study, the insulin dose was intentionally kept constant to isolate the effects of canagliflozin on glucose levels. However, in a clinical setting, close monitoring and insulin dose adjustments would be essential to mitigate the risk of hypoglycemia. The study's findings raise several important questions for future research. For instance, the combination of canagliflozin and insulin might be particularly beneficial in dogs where insulin therapy alone struggles to maintain stable glucose levels throughout the day, such as cases with significant fluctuations despite careful insulin dosing. It could also be helpful in managing dogs with insulin resistance. However, the researchers caution that reducing insulin doses, especially when adding an SGLT2 inhibitor, could potentially increase the risk of DKA. Therefore, they emphasize the need for longer studies involving a larger and more diverse population of diabetic dogs to fully evaluate the long-term safety and efficacy of this combination therapy, particularly concerning the risk of DKA. Interestingly, a similar study in diabetic cats found that when an SGLT2 inhibitor was used in conjunction with insulin, the insulin dose was substantially reduced in all cats and no episodes of hypoglycemia occurred. This discrepancy between the cat study and the current dog study suggests that the necessary adjustments to insulin dosage when adding an SGLT2 inhibitor may differ between species, highlighting the need for species-specific guidelines. Both studies, however, found no significant changes in ketone levels during the relatively short treatment periods. The researchers in the current study also point out that they intentionally excluded dogs with very high initial glucose levels, which might have contributed to the lack of DKA cases observed. The short duration of the study, only 7 days of canagliflozin treatment, might also have influenced this outcome. Beyond glucose control, SGLT2 inhibitors in humans have demonstrated additional benefits, including weight loss and improvements in cardiovascular and kidney health. While this study did not observe any changes in body weight in the dogs, the researchers suggest that the increased glucose excretion could potentially lead to weight loss over a longer period, similar to what is seen in humans. However, they also note that obesity is not as strongly linked to spontaneous diabetes in dogs as it is in humans, potentially making this aspect of canagliflozin treatment less critical in canines. The potential cardiovascular and renal protective effects seen in humans treated with SGLT2 inhibitors, such as reductions in blood pressure and improvements in kidney function markers, warrant further investigation in diabetic dogs, as hypertension and atherosclerosis have been reported in this population. While this study did not find significant changes in sodium excretion, longer and larger studies are needed to determine the clinical relevance of these potential benefits in dogs with diabetes. The researchers acknowledged that their study had limitations, including the small number of dogs and the short duration of treatment. Despite these limitations, the study successfully demonstrated a significant effect of canagliflozin on interstitial glucose and urinary glucose excretion. Future studies with larger groups of dogs and longer treatment periods are essential to fully understand the long-term efficacy and safety of combining insulin and canagliflozin in diabetic dogs, particularly concerning the risk of DKA and other potential side effects. The researchers also suggest exploring the use of lower doses of canagliflozin in combination with insulin, as this might help to lower glucose levels without increasing the risk of hypoglycemia. They also note that future studies could benefit from including formal urinalysis to complement owner observations of urination patterns and exploring more complex methods for measuring urinary glucose excretion in controlled laboratory settings. Finally, future research could investigate how the addition of canagliflozin to insulin affects the daily fluctuations of glucose concentrations. In conclusion, this study provides valuable initial evidence that the addition of canagliflozin to insulin treatment in dogs with naturally occurring diabetes can significantly lower interstitial glucose levels, likely through increased glucose excretion in the urine. However, it also highlights the critical need for careful monitoring and potential insulin dose adjustments due to the increased risk of hypoglycemia. Any reduction in insulin dosage, especially when combined with canagliflozin, requires close observation for clinical and biochemical changes, including monitoring ketone levels to detect any early signs of DKA. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.